That's what I came to know very recently. I thought it was active only for a month or 6 weeks.
Okay.
So the viewers watch it at their own convenience over the weekend.
Yeah, fine.
So
Okay.
you have views which kind of keep generating after the talk.
So,
In fact, more
just
so
I'm
after the talk.
interrupting. Sorry, I'm just
Yes, yes,
interrupting.
yes.
Sorry. So,
Yes, yes, no
five,
problem.
4, 3, 2, 1, 0. Good evening. I'm Rahul Chobe from Physio TV. We are live now. I'm handing over the session to Dr. Sona to introduce the speaker and the panelist.
A
Over
very
to
good
you, Dr.
evening.
Sona.
Sorry. Yeah. On the onset, let me wish everyone a very happy new year, a very happy and uneventful, I would say, 2021, because we had 2020 as a very eventful year. And hopefully that should be behind us, and 2021 should be a new start for everyone. So at the outset, let me welcome everyone from Physio TV. I'm Sona Kolke. I'm an associate professor at Sancheti Institute. And today we have yet another talk on Physio TV, which is going to highlight on the 10 cardinal rules of online presentation. I'm sure with the teachers and even the current pandemic situation since March, there have been a lot of us who have kind of sought help of the online presentation platform for delivering not only the talks but reaching out to someone and educating students, educating professionals. There have been a lot of virtual conferences also which have kind of taken place in the online forum. And Sir Bhave sir, being a pioneer now in his field of rehabilitation, has come out with this 10 cardinal rules, which I'm sure will help every online presenter out there. So basically, with all our recipients not only watching us in big screens or their laptops, we have a lot of student population and therapists who are watching the talks basically on their small screen or the mobile screen. So what should be the cardinal rules for presentation? So we'll be just, Bhave sir will be just highlighting that. We have our esteemed panelist, Dr. Tushar Palekar, with us, and I'll be just giving a brief introduction to him. So, Sir is a professor and principal at the DY College of Physiotherapy at Pimpri in Pune. He completed his graduate degree from Mangalore University in 1995 and his post graduation in sports medicine and sports physiotherapy from Aurangabad. He also has completed his PhD in 2015 from DY Patil. He is a professor and principal at the DY College presently, but he is also Dean, Faculty of the Allied Medical Sciences and Chairman, along with member of the Board of Studies and Board of Management at Dr. DY Patil Vidyapeeth in Pune. He is also the member of Board of Studies with PIMS, Loni, Karad, Savita University, Chennai, KLE, Belgaum, and also a doctoral committee member at Wales University in Chennai. He is a member of the Maharashtra State Council for Occupational Therapy and Physiotherapy. As a physiotherapist, his keen interests are in field of hand rehabilitation, manual therapy, and EMG biofeedback. He's also been a guide to graduate, postgraduate, as well as a PhD guide in and around Maharashtra, as well as outside Maharashtra. He's contributed as a member of the selection committee and the various inspection committees of MUHS Nashik, DMER, IAP, and the NAC committee. Tushar Palekar is also an active recipient of awards at various conferences. He's been the joint organizing secretary at the 49th National Conference of IAP in Pune. He has bagged several prizes for scientific and poster presentations and has been a recipient of many awards, including awards from IAP of Certificate of Appreciation, Significant Contribution Award, Award for Meritorious Service of Manual Therapy, which was awarded by Dr. Brian Mulligan himself, Dr. M.G. Mokashi Best Teacher Award, Yuva Yuvati Puraskar by Maitri Parivar in Pune, as well as the Best Professor in Allied Sciences of Medical Sciences, Allied Medical Sciences in Pune. He's also been awarded the Best Researcher Award in Theracon 2019 in Salem and Best Principal and Professor Award at Global Teachers Conference in Mumbai. He also has received Distinguished Alumni Award in the Excellence in Academics for dedicated service in the field of physiotherapy education from SRM College, Chennai. Sir, over to you.
Thank you, Dr. Sona. When it comes to the curriculum vitae of Dr. Anil Bhave sir, I am proud to have this privilege to read out on his behalf and the moderator's behalf. I am very much glad that this TV has given this opportunity to give us contributions and have Dr. Anil Bhave sir with us. Sir has a huge exhaustive curriculum vitae which runs into pages, and it could be an easily a book written by itself, but concising was a big major part that we could do. And thanks to Dr. Sona Kulke ma'am for doing this for me. And I would like to read out a few glimpses of Dr. Anil Bhave sir without missing out his major credits. He is the clinical director of the Orthopaedic Rehabilitation and the director of the Wasserman Gate Laboratory at the Rubin Institute of Advanced Orthopedics at Sinai Hospital in Baltimore, Maryland, USA. He is the recipient of several awards, including the Jacqueline Perry Award, IAP Oration Award in February 2001, and 4 times the Champion of Care at Sinai Hospital. He has quite a few number of patents filed and also in process, and an app which is being developed, namely the Guardian Sports Extension Brace CKD device for contractures of joints, which is the patent that is filed, and few more which are in process. The app, the Triage app for THR and TKR patients, and co-author of the famous multiplier app used for calculating limb lengths. He has many certifications to his credit, including the blood flow restriction therapy, ASTYM therapy, dry needling intramuscular therapy. He has been instrumental in establishing the GATE lab at Sinai Hospital, as well as developing rehab protocols for various musculoskeletal conditions, including their prehab and post-operative management that have now become standard of care in various institutions nationally and internationally. He is a consultant with therapeutic modalities companies, including the Stryker and the Medica. He is on the editorial board of many peer-reviewed journals, including Physical Therapy, Journal of Orthopedic Research, Clinical Biomechanics, just to name a few. Sir has also worked on numerous grant projects and has 76 publications in peer-reviewed journals. Sir has also authored many chapters in textbooks of rehabilitation as well as orthopedics, and is the main faculty for the annual Baltimore Limb Deformity course and annual hip and knee course, and a faculty at the School of Physical Therapy at Maryland and Virginia. Sir has also been the course chairman at 15 courses and given 341 lectures nationally as well as internationally, almost covering 9 countries. So we have here the legendary Dr. Anil Bhave sir with us. Over to you, sir.
Thank you. That was wonderful. You did a great job. So good morning to everybody from US. Good evening in India. And before we start this presentation, I want to say that 2021 is going to be the year where Corona will be called beer again. I guarantee you that. The way things are happening, it will be the year of beer again. So with all that hope that we all express in our life coming this year, I wanted to present on a topic that is different than I usually present on. I usually present on topics related to rehab, orthopedics, biomechanics. But I wanted to present on something, and some of this may be very basic, but I think having observed presentations, I thought it was very important to highlight some of the rules of presentation that make the presentation better. So even before we start, let me share my screen in a second. That's my institution. This is where we have been struggling for last 1 year with the whole COVID-19 situation. We have worked throughout the system. The system has been running well. We have had to resort to a lot of our meetings that are now online. We don't gather as a group. We are 150 rehab professionals just for rehab. We have to have a big, large auditorium for meetings, which all have gone to online. So, plus I have done educational webinars, seminars, and have also taken many as a student. So there are certain things that I wanted to share. The first thing was you must have handout, and the speaker must have points written out that he wants to present. We cannot do off-tempo presentations all the time. There are many hundreds of people who are watching you and they are learning from you. And it's important that you have a written out, thought out strategy. So I always have either a paper handout for myself, or I have something on my desktop when I'm presenting from my laptop. So some of the prep rules are handout or notes must be available. Please check your laptop and make sure that it's 100% charged. Check your internet connection. In US at least, we can do this where we can use our phone if you lose an internet connection. Phone can be a host and you can use that. And many places it can be done. When broadband or bandwidth is low, reduce your media and check your media that it works on the bandwidth available. Join early like we did today to check, and use Bluetooth whenever possible. And if not, make sure that you are in a less sound or soundproof room where nobody else, you're not putting the ambient noise or ambient thing. And when you're not speaking, mute your connection so that there is no echo. Let the speaker present. So with that preparation, let's go on, move on to the next slide. And I'm going to present like this. So this presentation is based on being a presenter as well as taking online presentations. There has been an explosion of online presentations post-COVID-19 era, and the trend to move part of education online will continue after COVID-19, in my opinion, at least partly, if not fully. So before starting presentation, the first thing I like to do is request that all attendees put microphones on mute, except my microphone, the presenter's microphone. And the next thing I like to do is don't like sound. Very discouraging to hear dogs barking, pressure cooker going off, babies crying. You know, your time is as valuable as everybody else's time. So you don't want to distract people with noises that they don't need to hear. So that's my rule number one, is that request all attendees to put microphone on mute and make sure that there's no ambient noise coming from everybody else. Please turn your camera off. When sharing your screen, best to turn camera off, especially when you're showing a technique. Too many times, especially in physical therapy, I have observed that the slide share is going on, and in the camera, the small camera, people are demonstrating a technique. It's very distracting and it's very small. And Sona said it very nicely that 50% or more of audience or consumer is watching your presentation on their small smartphone or their tablet. And I have some other slides to share with you as to what happens when you're watching on a small screen. So if you look at my screen, I like to make my slides very bold, and my font is at least minimum 40, and we'll talk about that in a second. So simultaneous presentation, especially when you're doing a technique presentation, for presentation like this, it could be okay, where you are seeing me in the small camera and you can actually see my slides simultaneously, that's okay. But if you're, let's say you're showing a technique in physical therapy, then always turn your screen sharing off and let just the camera be your presenter. And then people can see what you're doing in terms of technique in a large. Some other people, what they do is they have two links. They take it on their smartphone as well as on their PowerPoint laptop. And then when they want to show a technique, they can actually just use their smartphone to project onto Zoom or whatever platform you're using to show the technique. So there are several ways you can do this. So the important message for number 2 rule is when you are sharing your screen and you want to show a technique, especially turn your camera off or use a smartphone separately and show that or share that instead of sharing both. So the important message is highlight what you're trying to do and not show too many things. KISS is not keep it simple and stupid. KISS is keep it simple and straightforward. Please remember that you are presenting to teach and improve knowledge and sharing your experience, not to show how smart you are. Don't make it too complicated. Make it simple, make it straightforward, break it down into multiple slides if you have to. Remember, the rule is you can't put too much text. Don't put too much text on it. People get distracted. Most people don't like it. Your audio is a very powerful medium. What you're saying is very powerful. So use that to your advantage, but keep it straightforward, keep it simple, and you're trying to teach and improve knowledge. And improvement in knowledge is only done when it is explained in a very straightforward, simple fashion. Because there are always various levels of experience, intelligence, and understanding in your audience. And there may be 25, 30% who are not as experienced or as savvy as the other 60% or 50% are. But your job as a presenter is not just to teach the smart people or people who know this. Your job is to teach the people who have no idea or no sense of it. So you need to bring 100% of the people along with you. And for that, you have to keep it simple and straightforward to explain any topic. If you can't, I always say this, if you cannot explain what you're saying on the back of a business card that you can write down, then it's not worth, you're not going to be able to present well. Because if you can take a business card and write on the back of it and explain that to everybody, I think majority of people will get it as long as you keep it simple and stupid. So most of my slides, if you see, I try very hard to, the content that I keep on my slide is equal to what I can write on the back of my business card. That's how I like to present. So for me, the rule number 3 is keep it simple and straightforward. Only put enough material that is on the back of a business card that I can write with a decent font, and explain and use your audio as your additional convincing medium to impress upon the topic that you are trying to explain. Number 4 is, of course, content, simplicity and engagement of the audience. So it becomes very challenging. We'll go from bottom up. It becomes very challenging for engaging audience and keeping them. There's something in the in the internet world. It's called the app. If you make a new app for iPhone or Google phone, how many downloads are there of your app? But there's another important factor is after the download, how many times people used it first time, and how many times people used it second time, third time, fourth time, fifth time. That decides the engagement. And I apply the same rule for online presentation. How many people join, but how many people stay with it? That's very important because you have to keep the audience engaged. So you have to use certain tools, which I will discuss in my rule number 6, 7, and 8, where you must engage your audience so that they feel that they want to stay for this. The other rule I have is in order to keep engagement of people, you must have one slide per thought, or you have one thought per slide. So that it's in a rapid fashion of engaging people with a thought and move on to the next one. They should feel like they should watch. It's like a movie. You want to watch the movie. It's a serial that I want to watch the episode 2, 3, 4, 5 in the same day and not wait for it tomorrow. So engagement is very important, and you can do it, and we're going to explain some of that. And simplicity matters. Again, I said that simplicity matters. But the most important thing is content. Content has to be important because people want something new. And if you give the same, this is the anatomy, this is the physiology, this is the standard of care for treatment, that is not something people are going to be engaged by. So content matters. And I have realized some of my own mistakes in content. We have, that's why feedback is so important. But one of the things that I changed my slides to where I show a patient example first. Why do I show that? Because I want to improve engagement. I want to get people excited about what I did. So I show a case. It could be a success, it could be a failure, but I show it because it's important to get people engaged, and the content matters. So after I show the slide of my patient, of my failure or success, I discuss what the problems were, why the failure, why the success, what could have been done better. Then I talk about the relevant anatomy, physiology, and what can be done. So we have to change our way of typical presentation, because it kind of gets boring sometimes, to be very frank. So we have to change our content. We have to have references. Always give credit. I've seen many slides where people are taking images from internet or from Google or from books, but they must give credit at the bottom of the slide of where that came from. So person who is viewing it can go back and look at the source and see what else was there. So referencing is important in the content. Simplicity is important. Making it interesting is important. So that's my rule number 4, where it's critical that we follow these rules. Rule number 5, it's all about font. What font? And this is something that has been done before. It's not just for online, it's also for offline audience presentation. So the type and size matter. So on this presentation here, you can see that my red ellipse shows a type of font. This is a commonly used font called Times Roman. If you have it bold enough, it doesn't matter, but it's smaller, it's hard to read. So any font that is more like this, we call it sans serif fonts. If this font is like this, it's difficult to read as compared to a font like this, which is more equal in its distribution. So this is an easier font to read. This one is bold and still I have a hard time to read. And this is regular, but same size, and I can read. Most online presentations, what I believe is that the font size more than 36 is readable even on smaller devices. Ideally, I like to use 40 and above, and my preference is to use 52 and above if I can. So that means you cannot put too much content in the presentation and have more simplified slides again. So type of font matters. So choose your font carefully. The standard fonts that are useful to use are Arial, Garamond, Abadi, Calibri. And then the fonts that are not so good to use, in my opinion, are the fonts like Times New Roman and stuff like that. So I don't like to use Times New Roman. It's good for typewritten material. That's a standard font for writing letters on a printout. It's not the best font for presentations because it's a little bit difficult to read. So that's my rule number 5. It's all about font. It's all about size of the font that matters. Don't put too much content on a slide, and so that you can get a larger font again. So this is about the slide master. If you use a slide master, and when I say master, I mean you create a slide master that works for you. And I don't know if you all use this. If not, you should definitely get into habit of using a slide master. For me, a slide master is a dark background with a yellow title and a white text. That's what I use. I feel comfortable with that. That's how I like all my rehab, medical talks, ortho talks done as much as possible, except when I'm using graphs or pictures. I may change the background just to look it better. But in PowerPoint, if you're using PowerPoint, you have a slide master that you can use. So why use slide master? Because if you use slide master, it's a concept. You can use it in the PowerPoint, or you can make it a concept for yourself so that it maintains a consistency. It's distracting if you use different color schemes for different slides. This is not an art show. This is an educational material. So it maintains the consistency of your slides, and there is a theme for it, and it's not jarring on your eyes. So I like to use the slide master. The color scheme matters. I think having a simple color scheme, not too many colors, not too many different fonts, having the same font, same color scheme throughout your presentation does matter. And you should select your scheme and stick to it. Don't change your slides from one scheme to other scheme to third scheme. And then what happens is we all present many times, and we borrow slides from our presentations and stick them in our presentations. And then it looks a very jumbled up, very like a khichdi, too many things on. So select your scheme and select and stick to it. That's the best way to present. And choose neutral or dark color. Or if you don't like the dark color background, then use a blank or a very light color background with dark text. So you have two choices. One is to choose a neutral or dark color and then use a light color font, or use a blank or a very light color background and use dark text on it. You have both the choices. I try to avoid the use of red as much as possible, except for arrows, because red is not something red, and the near the red colors are usually not seen very well on presentations. Some people are color blind, especially for red. So I try to avoid as much as possible red. I use it for arrows mostly to distinguish between certain things. So rule number 6 is all about slide master. You have, if you are using PowerPoint, it actually gives you the ability to create a slide master first. It maintains consistency. You have maintains a color scheme that you choose and you stick to it. And then you have the choices of a neutral or dark background, or a blank and a light background. And then you vary your text accordingly, and that maintains the consistency. So that's important to remember. Many times, if you don't use a slide master, your font changes from slide to slide, or your color changes from slide to slide. This is very important to me. I call this, consider how audience is viewing your presentation. And if you look at my presentation today, there will be some people who will be online today. There'll be some who will drop out and will say that we will watch it later. There'll be some people who say, oh, I couldn't watch Anil Bhave's presentation, but let me watch it later. And what's the common viewing platform that one will use? They most likely will use their smartphone. Some people will go home and put it on their laptop, but even laptop is not very large screen. It's 11 inches, maybe 10 inches screen, or their iPad or their, so the screens are not as big. When we present, we are used to presenting in auditoriums with large screen, people are presenting on a large screen. And it's very, large screen is very tolerant. The small screen is not as tolerant. So what I did is I did an example. I took a PowerPoint presentation and I did two pictures of it. So the first picture is a slide of dynamic causes of malrotation. And I took my iPhone and I made this font bigger, 60. And I have a lot of text here. So my mistakes here are that I have too much text on this. If I keep reading this throughout, it will be boring to somebody. And it's not easily viewable. If I sit in the back and if I have my phone on, it's not as viewable. So I don't think we should. So what I did is I sent a presentation to my own iPhone and I took a picture of it with another camera, and then I'm presenting it to you. So this is not as readable, and this is the best worst case scenario, meaning I made the font bigger. I kept this background very dark and nice and white of this. But then look at this, when I reduced the text and I kept the same font, it's so much more readable. Even on a smartphone, one can read it. So my experiment was to make the same slide two different ways. Actually have a larger font in a first slide, but have a little bit smaller. I think this is 52, that was 60, but have less text on it. And I took a picture of the same screen on my iPhone at 10 feet away, which is usually what the viewing ratio is. So the bottom line is, if I have my text like this, even a person who is watching my presentation online is able to read it very nicely. As you can see, you can read this much easier than the previous slide, which we'll go back and show you. That slide is not as easy to read because I have too much text on it, and I need to reduce it and make the font even smaller. I can do it if I can have this. So it's important that we understand how people are looking at this presentation. So that's a key to change from what we have done in past in terms of presenting in big auditoriums to how our audience is now viewing our webinars, seminars, panel discussions, whatever it is. So I like to, again, emphasize the simplicity, larger font, and text that is not too much on each slide, and use the audio as another powerful medium to explain your points. Number 8 is about animation. How to use animation. PowerPoint, all PowerPoint makers should be aware of this, or insert lines, insert arrows, insert shapes, insert pictures, and animate. That's a very critical component of a multimedia rich presentation. I think this is, I cannot emphasize this anymore, because you are engaging people most likely with a very small image. You're engaging people more remotely. You're not engaging them one-on-one. There's a power of presenting in the auditorium. You are larger than life there presenting. And if you are a great presenter, people just are awed by your ability to present your lifelike picture there, you presenting it. And if you see even larger, if you go back to larger meetings that we have had in India, they even have cameras and project the speaker on multiple TVs that are sit in the back, so everybody can actually observe the slides and the speaker in a large fashion. Well, when you're doing online, you don't have that ability. So highlighting using animations is very important. So lines, arrows, shapes, and pictures, all are important. I have an example for you of this. So here is a measurement of what we call prone internal rotation measurement. So I have it here where I am showing that and my convention is, and you can make your own, is that neutral is always blue and the angle is always red. And this is the only part where I use reds. So here you can see this person's external rotation and internal rotation, and then the thigh foot axis. So what I have done here is I drew the arrows on it so people can see it very, very vividly what it is. And then I will use a further multimedia presentation to bring in an arrow. Then I can bring in a second arrow. So what I'm now pointing out to is what is the patient's external rotation, what is the patient's internal rotation. Then I bring, so I'm talking and I'm going through this, and then I'm bringing max internal rotation, max external rotation. So it becomes a little bit more interactive. In the meantime, I have the slide going on here that shows what we call thigh foot axis angle. So it's an angle between the thigh and the axis of the foot, which goes from the center of the calcaneus to the second metatarsal head. And then I can say thigh foot axis. So it becomes more interactive and people get it. Because many times what happens is if you don't have any of these lines drawn, and I'll go back to my slide to show that, I can say here, oh, this is thigh foot axis. I scroll my mouse like this. I scroll my mouse like this. People don't get it sometimes, or people miss it sometimes. So it's very important that you have use of lines, arrows, and text that highlights the points that you're making, that, okay, this is max external rotation, max internal rotation. And think of a student who has not done this before. It's everybody should learn from your online presentation. So it's not just a expert clinician, but also a student. And many times one of the things that we have to emphasize, which I want to do more, is educate our patient. How are we going to educate our patients and make them more aware of rehab and wellness if we don't make it simplified and simple so that everybody can learn from it? So use of lines, arrows, and text matter. So then you can say that I'm doing a very careful rotational measurement in a patient that I suspect having either an anteversion problem or a tibial torsion problem, and this is how I will measure. So then it becomes a very rich multimedia presentation. So that's very important for me to present like that. The next slide, emphasize and animate also is important. So what I mean by that is you must emphasize your slides. You must highlight some of the things. For example, I have a slide here. This is a slide from the chapter I wrote in a book called Deformity Planning for Ortho. The book is for orthopedic surgeons. It's a book about the abductor lever arm and the forces around the hip joint. So in the slide here, you can see that this is a normal gait, normal walking. The green line denotes a ground reaction force vector. And the distance from the center of the femoral head to the ground reaction force vector is denoted here. In order to reduce the lever arm or reduce the abductor force, one does rotate their trunk to the side that their stance faces on. Now these arrows this is not very clear to me how much the distance is reduced. So when I say this, what I mean by this is I want to emphasize this. So how do I emphasize this? Well, I can cut this picture again and just emphasize on those arrows, and I can bring in my what I call animated picture here, and I can actually cut it and I can show better. Is if you can see here now, this distance is greater than this distance here. It's very clear. And I can highlight it further by putting the arrows there. So I can put an arrow here, I can put an arrow here and say, look, if you highlight, so taking a picture of a picture, cropping it down to highlight what you're trying to show in a bigger picture is one of my favorite things to do, and especially makes a lot of sense on an online presentation. And we can use it many ways. But this is my way of doing it, where then you are using this very rich animation type of thing, where you bring in a picture, magnify it so that people can see it very nicely. And if you do that, then you make your point better. So that's my again, my rule number 9 is emphasize and animate, so that you can actually see in detail what you're trying to say. Guys, remember this, half the audience is going to watch this on a phone. And maybe we should start now making our online presentations and view them ourselves on the phone, which I have started doing, to see how does it look on a phone, because that's how people are watching it many times, not always. So that's the important criteria. Again, emphasize and animate. And this is a very complex picture. We have lots of in overall healthcare. We educate with pictures. We educate with highlights, but highlights come later. First come our pictures. And our common strategy for pictures like this is to actually scroll the mouse, or sometimes you can go here and you can select a laser pointer, and you can then use the laser pointer and you can show the distance here. That's another way to do it if you want to do it. So so that's important to remember, that bringing a picture in, zooming it in. In PowerPoint, you have to use cutting a picture. In some other programs, you can actually just zoom on it and you can make it larger. But those are, you have to pay for it. So I didn't want to show that. But this is an easy way to do it for anybody. And I think it's very important. And I hope that is something that you follow, because it's a very easy tool to do it. And last one, this is very important, video. I think video is a must-use medium for presentation overall, but it's I think more important for using it in online. My preferred method of using video, especially when I'm trying to show a technique, is to have a full screen video. So I either turn off my presentation, sharing the screen part, and I just let the video run it if I'm doing a live technique demonstration. I prefer to do most of my technique demonstration using a video that I take a already recorded video, and I embed that. What does embedding allow me? Embedding allows me to trim my video in PowerPoint itself. So it's, in my opinion, it's very important that we take a careful video of whatever we want to show and use it in the slide itself and make it full screen to show the technique, rather than having your slide up there and showing it on a very small screen. Nobody sees anything on a screen which is your screen sharing your slide and showing a video. It cannot work like this. If bandwidth is an issue, you can use the manual control to advance your video to highlight if your video doesn't stream properly. So I prefer to use an embedded video rather than actual demonstration, especially when slides are on. In PowerPoint, it's very easy. You can record a video and embed it. And once you embed it, now the newer PowerPoint, it keeps it there. You don't have to even keep it with the slide presentation. It's already in there, as long as your videos are not too large. So having multiple videos of a technique, showing steps in a technique of 10 to 15 seconds. And when I say that in physiotherapy, it really works. Because if you see each stretch, if each manual procedure or exercise we do has a start point, end point, and something in between. And those functions are not very long duration. We do multiple reps. So if you take the one rep and you actually show the starting position with a picture, a video of what is happening, and then at the end, what is the ending position, and then show a second slide with another video of different technique. You can go on like this, and you can make it very easy to understand and interactive. And one of the things that is good about embedding videos is then you can repeat it. You can repeat the video and show again, and show again, and show again. So make a point, because repetition always also helps with learning. So these are some of the techniques that I have learned and used. So I will show you here. This is a video of a patient. It's a case study of patient who had range of motion problems even after lysis of scar adhesion and arthroscopy. So this patient's video is here. So I have the manual control. I have embedded it in my PowerPoint. So all I have to do here is to just show it to you. And it shows you can also change the playback speed. When you embed the video, you can reduce the playback speed and you can show it in slow motion. Or if bandwidth is an issue, which sometimes can be, you can actually take this and slowly drag it to show slowly what's happening. So that's her maximum extension. She's lacking extension by about 15 degrees. And then you can go back here and say, okay, let's see flexion. And she is going down and she's bending about 75, 80 degrees. And if you want, you can draw lines on it, So it's, and this is especially useful technique for when you have a low bandwidth and it's not streaming as well. You can actually control the video. You can't do it if you do live demonstration of technique. So that's why I like to show this in slow motion. And the same thing here, this lady is now doing a heel slide and you can see that she's not extending her knee fully and her flexion is again not up to 90. So we are just showing a slide of that. Now I can also slow this down further and control it where I am controlling the video playback. So it makes it very rich and very powerful in terms of the audience. So, or you can let it play like this. You can draw on it with your laser, or you can draw lines on it. So the important message here is embed your videos whenever you can of technique or a patient posture or a gait or complaints, or sometimes you just want to record a video of the patient before and after. And then you can play it and you can trim it and you can really use only the part that is most important. Many times this time is spent in positioning the video when you do it live. And sometimes live is important and then you do it, but you follow these principles. And the last slide in my presentation is this slide here. So here is a guy who is doing eccentric contractions. So I'm showing this full screen first to show that this is a post-total knee patient who is working out on the biodex using eccentric contraction for tissue lengthening. But then I want to show all the techniques that were done with it. So I want to show that this is a splint that is used for stretching. This is the A-stim tool. This is the way we do patellar mobilizations. And this is the way we do the squeeze technique in mulligans to get more motion. And then again, we can show this slide. And this is my final technique. So now I have 5 things shown in one slide, but I made it more interactive to show everything. Now, if I want to go back, I can highlight this. I could have taken this picture and done another animation of blowing it up so I can actually show the contact here, or what this knob looks like in close-up, or how my hands are placed. I could do that, or I could animate my arrows and bring them in, but then I can show the video at the same time. So basically, you can make your presentation more interesting by doing this. You don't have to always use funny pictures. Something about funny pictures I want to mention here. Please don't use funny pictures more than once, maybe twice. If you use funny pictures in every slide, I think people don't take you seriously, in my opinion. So those downloadable funny pictures that we use in slides, don't use more than one or twice. Make your point and move on, because we are doing serious work here of educating people. So it's important that we stick to some of these principles and follow them through. And we keep learning. We keep learning from feedback from audience to make it even better every time. So everybody has a smartphone. Everybody can take videos. Use those in your presentations. Make sure that it's not just models that you show, you actually show patients. If you're doing clinical care and presenting on clinical care, show your patients. Mark, I like to block the faces of the patient whenever we can, because you don't want their pictures, because this presentation will stay online. So I try to do it, or I take consent of patients that they allow me to take it. So my standard is to take consent of everybody if I'm going to use them on my presentations, because these presentations will last forever now. It's not like you present in a conference and people forget about it. This will stay because of new technology forever. So make sure that your patients agree to show their faces online. That's an important aspect. And about funny pictures, be careful. Don't use too many. Don't use offensive things that some people may not like. I made a mistake of it once. I presented on something where I had a picture from one part of the world, and I identified that country, and there was a person who had immigrated from that country, and he didn't like it. So try to be a more we have to be more cognizant or aware of that fact. But with these 10 points, hopefully I have given you some ideas how to make your presentations more powerful, more engaging, and still be able to teach people. So I'm now going to stop sharing my screen, and I want to thank Rahul, Sona, and the panelist Tushar for giving me this opportunity, as well as the entire Physio TV team and the Ortho TV team for presenting on this different topic. I felt it was important that I share my personal experience with you. And I'm not saying that this is the only way to do it, but this is my way. I wanted to share it with you. And hopefully you've learned something from it and you will use it in your practice. Thank you again.
That was a wonderful presentation, enlightening us on various aspects of the online presentations, especially these days, as Dr. Anil Bhave has said. I think it's a message to the viewers of the Physio TV, the Ortho TV, the Rheumatic Arthritis TV, and all the viewers present out here, that we have to have this U-turn in the life during the presentations that need to be done, especially now the online presentation formats that need to be developed in a more structured format. So we have learned about structured questionnaires, structured way of teaching, but now this era has given us something to learn more. So 2020, although it was an era of the COVID, but then I think it has given us a chance to learn something out of the box. So these things which are never covered as a part of the curriculum or our own self-learning activities, today the self-directed learning process happens, the student-centric learning happens, but I think this is something out of the box that we have to learn to commercialize what we are going to give it to our students or to the co-colleagues, faculty, and the fraternities at large. So possibly sir has given an insight of all those activities that can be done right from the scratch at an undergraduate level to the PhD scholar level, or even at the professional level. I think these points we will have to take up and make our presentations more bolder for the appearance to the students and the viewers, basically. And you have very rightly pointed out about the font and the size and various things that needed to be projected. As a physiotherapist also, you have shown how the mobilities can occur and the arrowing given, and that gives a proper picture of how it can be projected and made well understood to the fraternity at large. Sir, we do understand that the online audience is vastly different from the the live audience that we have usually. So let it be a classroom or something like that. So we have the students in front of us, but the today's audience is maybe on an online mode. So online audience is completely a different era that we are facing. And as you have put up all those points aptly, so definitely these points will help us in proper communication to the students and giving the knowledge in more appropriate manner than we were still giving. And possibly these words will go a long run, and I just came to know that the presentations will be there. So definitely the students and the co-faculties should learn about the quality of the presentation that needs to be enhanced. Sir, you have also given us the example to show, put it on the mobile. So a small screen also, how does it look, should be assessed by the presenter himself first. Then it could be viewable to the attendee of the webinar or an online presentation. So definitely it will take a long run for the attendees to have a span of attention that can be more in length, because usually nowadays what I have seen as a principal of a college, I have seen that students are having a very short span attention, and very soon when they are off the video, then they have their atmosphere at their own pace, and they are not controllable at anywhere. So let it be at home or the classroom or wherever they are not controlled. So definitely these presentation will catch up the attention of the audience. And definitely, sir, I just want to put up one small question. So what do you think about sharing the script or the notes that we usually prepare? If we can give it out to the students earlier, so will that be of any use or benefit to the online audience currently, and then if an online presentation is given?
Yeah, I think that's a reasonable thing to do. I think that's a good point that we can mention here. Is that's part of the preparation. If you feel, especially if you're teaching a class, and I don't teach, you are more experienced in teaching classes. I only take certain classes. I don't teach full time.
Yeah.
But if you're teaching a full time, then having the notes available before probably will be a very good thing to do, because then they know what to expect. If they don't have to give them detailed notes, but if you can share with them what the basic things are, then they are more prepared. And for classes that you take, especially if you're doing a classroom online, I will make your students' life a little miserable. What I would do is, since you're sharing, I would start with 10 questions before you even start the class. And make sure, let's say you have 30 or 40 students online, they should be all present online. And you should ask with 10 common questions on what you think about. They may not answer you correctly on every question, no student does, but at least you have engaged them by asking them 10 questions. So we call it pre and post test, right? So, the pre-test, post-test. So you can use that here very effectively, saying, okay, we are sharing with you 1 week before. Here are 10 questions or 5 questions before the test, before the presentation. Here are the 5 or 10 questions after presentation. So now, if you don't attend the presentation, this, you can force this. I can't force this on clinicians. I cannot. Maybe with our giving CEUs, we are mandated to give. If you offer continuing education credits, then you have to give a pre and post test where you can do this. But otherwise, just presenting, you can't do this, right? But in faculty to student relationship, all of you can do this. Send the material out, ask 5 questions before, 5 questions later, you're done. Your class is over. And then you have an exam, of course, where you can do this. So it can be more effective like this. I think one of the things that I want to say, what I did is, every time I had to present online, I went back and pulled out my slides. As you know, I present many times before. And I put them on my small screen to see how easily my slides were readable. And I'm telling you, many of them were not readable. So I had to go back and change my slides, change my pictures so that it's easily readable. that was work that I had to do. And when I started doing this post-COVID, right away in March, I think April, I did my first big conference where we did a one-day conference in Brazil for Brazilian orthopedic surgeons. It was 5 hours we all presented. And we learned, all of us were thinking that, we didn't do such a good job. People were not engaged. They didn't ask enough questions. And we started realizing more what the online means. And it's different, totally different than presenting in a classroom or in auditorium. It's totally different. That's what I wanted to share with you. So people use, because I see too many still presentations. There's just a slide there and a speaker talking about it. And there's no interaction, there's no multimedia, there's no animation, there's no video or embedded video, as I call it. Then the other extreme is when you see people are just talking or showing a technique in that small camera and then sharing their screen. So when you project, when you see it, you don't see the technique actually, you're just still reading the slide. So it's important that you stop sharing and project the camera or embed the video, which is my preference. So I think it's important that we modify our technique for online and learn from it. We are all going to learn from it as we go. I learned a lot so far, and I'm sure I'll continue to learn more about it. And what my goal is to change from just doing a content or subject matter and do more case presentations, do more panel discussions, do more symposiums, and do less just a topic. Like I have learned from my mistake that it's not going to work out where you saw, like you take, for example, frozen shoulder, right? That's your topic. And if you're talking about frozen shoulder, you talk about the etiology, the pathophysiology, the anatomy, and all that. By the time you go to a technique, you lost 50% of the audience. So, do it differently where you have a panel discussion and I have a provocative question. Like I would start with a question saying, I don't believe there should be any role of physiotherapy in frozen shoulder. Just to get people into the topic, and then discuss what the literature says or what the personal experiences of expert panelists. I think we have to all learn from this and go on. My thing is, I very passionately believe that we have to use it more interactive, more simplified, straightforward, because you cannot teach unless the teacher knows, number one, how to make it simple and straightforward. If teacher doesn't know how to do it, everybody that is presenting is a teacher. I don't mean just the teacher at college. Anybody that is presenting is a teacher. Teacher needs to make it simplified, straightforward, and animated videos. All that matters in online presentation.
That's very clearly, vividly brought out a few points, sir, by you. Definitely, I think we would take up these suggestions given by you, and it will go for a long run for teachers to.
I want to tell you a simple example.
Yes.
I'm older than you guys are.
Sure.
When the PowerPoint first came, I'm talking about 1992 or 93. I went and took a class on how to make slides at Hospital for Special Surgery by an orthopedic surgeon who had actually taken many classes on this and actually went to a Microsoft Academy.
Oh, wow.
He's still practicing. So what I mean is, we all have to continuously learn and share. So that's why I like to share. You have to share these points that have made a difference to me. I'm not saying this is the only way to present. There may be, you might find a better, effective way to present, but it's important that we learn from what we have done and change it.
That makes you a wonderful teacher,
fact,
and a legendary physiotherapist. And it's nice to have you here, sir. I have one more small question to ask, if permitted by Dr.
Yes.
Sana, ma'am. It's just a small Now, you have suggested that the size does matter on the slide. So usually we suggest our students and colleagues to have 6 to 8 lines with, say, 7 to 8 words per line or something like that. So what do you suggest with the increased font? What would be ideally in the number of lines or number of words in the line?
I like to do no more than 4 lines or for online.
Okay.
Try to do 4 lines and each line to not have more than 5 words. I'm not saying that it's exactly 5. It could be 6, it could be 7. But in the, I'll do my slides where I have a title for everything. So the title is separate. So title is 1 line. And then in the box underneath, I like to do 4, maybe 5, depending on the topic. You don't want to have it broken up where you have 2 slides for 2 lines and 2 lines. So you want 4 or 5, I would say, and 4 to 5 or maybe maximum 6 words per slide.
Yes. And
but the more important thing is the font, the type of font.
Yes.
Many people I have observed are using Times New Roman, and it's not a very good font for slides.
Yes.
And I've also,
In fact, sir, sorry, sir. Yeah, continue.
I
Please
just saw
continue.
one more observation in Sir's slides that the coloration of the title and the content was slightly different from the coloration of the font size also. So I think that also creates a lot of difference to catch the eyes of the audience.
Exactly.
That is also one of the take-home message for us. Yes, ma'am. Over to you.
Yeah. There were a few questions from the audience, which I think Rahul sir has shared. And one thing has already been answered about what would be the best size font. I think sir had already mentioned it. I mean, something like about 36, if I'm not mistaken. So anything between 40 and 60 is something which would catch the eye of the person
Yeah.
who's attending the presentation. One person has asked, is it good to stand and present rather than sit? So what's your take on that?
I don't
I
have
don't
a
know.
take on it. I
Oh,
don't have a
don't you
take on it.
like it? Yeah.
Yeah, possibly.
The reason I sit is because I can advance my slides.
Yes.
And it's easy to control. I can do my laser pointer or a mouse, or I can
Yes.
advance. And because I use multimedia, it's important for me to have the control.
Yes.
I have presented before where I use a remote advancer, slide advancer, but those don't allow you the interactivity that your keyboard allows. So I like to sit, but if you like standing and you have the technology to do it, sure, you can do it. It's not, I'm going to stand now. What difference did it make? I'm now standing and now I'm sitting. Unless
Yeah.
you go far. So if you're going far, I'll go far and I'll show you. It doesn't, to me, it doesn't. And then what happens is like, now I'm going to stand. And I'm going to
Yeah.
go back.
Yeah.
So then my hand cannot reach my control. So that's the only thing.
Yes. I agree.
If you want to stand like this and do it, that's fine too. Here is I'm standing now. And I have my
Okay.
controls, so it's easy now. So I mean, it's your preference. If you
I
like
don't know.
standing, I'm fine with it. Yeah.
Yeah. I think to visualize, I think sitting closer to the screen helps, unless you're doing a demo, and if you're doing a demo, you are naturally
No.
little away from the screen. But
Yeah. If you're doing
apart from that,
demo,
I
you
think
must
sitting is the
always,
best.
yeah. No, when you're
Yeah.
presenting,
And
I think sitting is okay. If you're doing a demo, I think standing and doing it better. Only thing is then make sure that you're not sharing your screen and you're just sharing your camera. That's important.
so we are kind of very impressed by the embedding of the video and all. We do use that as a this thing, but I don't embed it in the PPT slide. I kind of save the videos separately and I stop my screen share and show the video. That's what I usually do
Oh,
during the
but
presentations.
then it's,
But this embedding is
sometimes
a very, yeah, it's a good idea,
yeah,
but
embedding, yeah.
I should try it. And even the animations of the arrows, and it really helped to bring out or emphasize, as you said very correctly, all the points that you were trying to highlight. So this is something that I think we should, at least I should. I have not tried the animations so much in my presentations, and I think that's
It's
a
like,
very good
if you see on PowerPoint, I'm going to bring it up. I'm going to share my screen. Okay.
Yeah.
If you see the PowerPoint, hold on. Let me share my screen first. I lost you.
The presentation. So you wanted to show
Can
the
you see my?
presentation? No,
Can
not
you
yet.
see my screen now?
No, sir. Yeah.
Can you see my
I think
screen now? Okay.
Yes.
yes, yes.
So if you go up here, you will see that there is a insert video. So wherever video you bring in, you insert it in your PowerPoint. Or if you use a slide master, you see this slide master. I'm bringing a slide master, and in that, if you see,
Yeah.
I can embed a video right there. So
Right,
I can
right,
click
right.
on this that says insert movie from a file, and then you can insert it.
Exactly.
And then you can trim it. Once you insert it, you can trim it. And for animation, you just go to animations.
Right.
First you insert. So go to insert, and what do you want to insert? You want to insert a shape. So I want to insert this arrow, or I can insert this arrow, or I can insert a highlight. There are many arrows. Lots of arrows are here. So insert an arrow, then you click on that arrow. So let's do that here. So here is my arrow. I want to insert it here, right? So I inserted it. Now I want to animate that video. So I go to animation and I say fly in. Now it flew in. That's simple as that. Now you can go here and you can modify how fast it comes in, slow comes in, and all that. So it's a very useful tool to highlight. That's not the only thing. You can animate your text. You can animate how it comes in, how it can
Yes.
blow up. There's
Yes, yes,
lots
yes.
of things PowerPoint allows you to do, which I think using it is my intent today was to show other ways to do it that can make a powerful presentation. And you can play with it. There may be better ways than even what I showed. Okay?
So there was some question regarding, I'm not sure about this. Is 16:9 a good size of the slide? A
Yes,
ratio of
it is.
16?
Yes. Yes, that's what I'm using right now.
Okay.
Yeah.
Okay. In
Yeah.
fact, so
Some people use 4 by 3, which is more squarish.
okay, okay, okay.
I like to use more stretch screen, which is 16 by 9.
Okay, okay, okay. Yeah.
Yeah.
And so you were talking about even watching your own presentation on the smartphone. So we have a
Yeah.
few teachers in our college who already do that, not only for seeing
Okay,
how
good.
their presentation looks like, but also to know when the net is shaky. So very often what happens
Okay,
is
okay.
even the
Yeah,
bandwidth
yeah.
in our college sometimes just goes off and we don't know about it. So we keep talking
Good point.
and the
Good
students
point.
are completely cut off. So, so they
That's a
come
good
to
point.
even know whether, yes. So they've become a part of
It
the
happened to
audience.
me.
Yeah.
I was doing an ortho webinar, and it happened to me where I lost my mic,
Oh,
and because of the WhatsApp connectivity, they immediately pinged me saying you lost your mic. You did it once too. I think once one of
yes,
our
sir.
seminars you did it also.
Yes, yes.
So sometimes it can happen. Yeah, you're right. That's a good point. Yeah, it's great. Great.
Yes, sir.
The
I guess.
post-COVID era has brought about a lot of explorations in the team of learning. So the educator needs to educate himself,
Yes,
and then the education of the educand happens. So that is
exactly.
how
Yes.
uh,
No, very nicely put.
the blend has been coming.
Yes, very true. Very true. Very nicely put.
Very,
Very nicely put.
very nicely put, Dr. Tushar. So yes, so I guess we can move towards ending the presentation now. So I would like to thank our panelist, Dr. Tushar Palekar, and mostly our speaker, Dr. Anil Bhave, who's our patron member, our mentor for Physio TV. He's been with us, associated with us for a long time, and he will continue to do that. So we have this continued support of Dr. Bhave in the Physio TV family. And I would like to thank Dr. Rahul, not Dr. Sorry, Dr. Mr. Rahul Chaube, sir, and Dr. Ashok Sham, sir, for their cooperation and giving us the tech support of OrthoTV for streaming the Physio TV talks. We also have to thank Dr. Parag Sancheti, our chairman of Sancheti Institute, and Mrs. Manisha Sangvi, who's our executive chairman. And with all that and the note of a very vibrant 2021, which is going to be even more different than 2020 and hopefully more positive, with the vaccine just around the border for us. And I think Dr. Bhave has already received his dose and is in process of receiving his booster, if I'm not mistaken, very soon. So yes, with that positive note, I think we'll be kind of having years to many more curated talks in Physio TV with continued support of all the esteemed faculty, panelists, and Dr. Tushar Palekar. We are expecting a talk from you also very soon. I'll be kind of getting in touch with you. With that note, thanks again, and we can end the session for now. Yeah. So very good
Thank
evening,
you
good
very much.
morning, everyone. Yeah, in US, and yeah, this is a bye from all of us.